The moment Colonel James Whitmore's eyes met hers across the ER, Sergeant First Class Maya Cross, now just Maya, just a nurse, knew her carefully constructed invisibility was about to shatter. 96 hours earlier, the overnight shift at St. Catherine's Memorial smelled like antiseptic failure and burnt coffee. Maya moved through the chaos like smoke, unnoticed in her faded navy scrubs, sandy blonde hair pulled into a haphazard bun secured with a rubber band and sheer willpower. 31 years old, and she perfected the art of being nobody. Cross, trauma 2 needs vitals. Dr. Brennan didn't look up from his phone, thumb scrolling through what was probably Instagram. And see if you can actually get it right this time. Maya swallowed the response that wanted to surface. Yes, doctor. Nurse Stephanie Chin snickered from behind the medication cart. Honestly, how did you even pass boards? Maya didn't answer. She'd learned that silence was armor. At Fort Bragg, she'd been a Special Forces combat medic who'd patched up operators under fire in Fallujah and Helmand Province. She performed field surgery in a cave with a headlamp and had earned a Bronze Star for pulling 3 wounded Rangers out of a kill zone while taking fire. Here, she couldn't get coffee orders right. Trauma 2 held a car accident victim, stable, conscious, scared. Maya's hands moved with practiced efficiency as she took vitals, her touch gentle despite the muscle memory that wanted to work faster, harder, like she was fighting for someone's life in the back of a Humvee. You're good at this, the patient whispered. Maya offered a tired smile. Just doing my job. The ER was understaffed as always, running on exhausted residents and nurses who'd stopped caring. Maya had been there 8 months. Not one person knew she'd spent 6 years in Army Special Operations. Not one person knew her call sign had been Reaper, because she'd pulled more soldiers back from death's door than anyone in her battalion. They saw baggy scrubs and quiet competence and assumed she was barely qualified. Cross. Dr. Brennan's voice carried across the ER. Patient in 5 is complaining about pain management. Deal with it. Curtain 5 held an older man, maybe 60, with a shoulder injury from a fall. But Maya's trained eye caught other details immediately. The bearing, the haircut grown out but still military short, the way he held himself despite obvious pain, and the faded tattoo on his forearm. 75th Ranger Regiment. Sir. Maya kept her voice neutral as she checked his chart. Maya. Let's see what we can do about your pain. Appreciate it, miss. His voice was gravelly, respectful. As she adjusted his he studied her face. You military? Maya's hands hesitated for a fraction of a second. Thought so. You move different. He nodded toward her technique. And that 4-stick was combat medic smooth. What branch? Army. Long time ago. She focused on charting, avoiding his eyes. What unit? Does it matter? Humor an old soldier. Maya met his gaze. Special Forces. Combat medic. 3 tours. His eyebrows rose. No kidding. You one of the cultural support team women. Something like that. The lie was easier than explaining she'd been attached to an ODA, working alongside Green Berets in operations that didn't officially exist. Before he could ask more, Dr. Brennan appeared with 2 other physicians, Dr. Walsh and Dr. Martinez. They were laughing about something, barely glancing at the patient. Cross, we need this bay. Brennan's tone was dismissive. Move him to the hallway. He has a separated shoulder and possible rotator cuff tear, Maya said quietly. He needs imaging, and I can read a chart. Hallway. Now. The patient's jaw tightened, but he stayed quiet. Maya helped him to a wheelchair, her stomach burning with familiar frustration. This was why she'd left the military. The bureaucracy, the egos, the way people treated each other like equipment instead of humans. Except the military had also been where she mattered, where her skills meant something. I'm sorry, she told the patient as she wheeled him into the corridor. Not your fault, miss. Some things never change. The night dragged on. Maya took vitals, changed dressings, fielded abuse from doctors who treated her like she was invisible or incompetent. At 0300, she stood in the break room staring at her reflection in the dark window. Pale skin, tired eyes, the ghost of someone who used to matter. Her phone buzzed. A text from her old team leader. Reunion next month. You coming, Reaper? She deleted it without responding. At 0430, the ER doors burst open and everything changed. For men in suits moved with unmistakable precision. Secret Service, though they weren't advertising it. Behind them came a stretcher carrying a man in his 60s, unconscious, with obvious signs of a cardiac event. And behind him, ramrod straight despite civilian clothes, walked Colonel James Whitmore. Maya's breath stopped. She knew that face. She'd briefed that face in a TOC in Kandahar. She'd worked under his command during Operation Phantom Thunder. Colonel Whitmore had personally recommended her for her Bronze Star. His eyes swept the ER and landed on her. Recognition flashed across his features, surprise, confusion, then something like concern. Sergeant Cross. His voice carried across the chaos. Every head in the ER turned toward Maya. Dr. Brennan's expression shifted from confusion to shock. Nurse Jen's eyes widened. And Maya stood frozen, her carefully constructed invisibility crumbling as the colonel crossed the room, his bearing demanding respect even in civilian clothes. "Ma'am," he said quietly, the word heavy with meaning. The ER fell into a silence so complete Maya could hear the cardiac monitor beeping in Trauma 1. Every doctor, every nurse, every resident was staring at her. The quiet nurse who couldn't get coffee orders right, being addressed as ma'am by a man whose command presence filled the room like a physical force. "Colonel Whitmore." Maya's voice came out steady, military trained, nothing like the soft tone she used with patience. "Sir, you need to step back and let us work." "That's my brother on that stretcher, Sergeant." His eyes were steady, assessing. "He's a 3-star general. Collapsed during a classified briefing. I need your best people on him now." Dr. Brennan stepped forward, his expression a mixture of confusion and territorial concern. "I'm the attending physician. We'll handle this. And I don't know who you think she is, but I know exactly who she is, Doctor." Whitmore's tone could cut steel. "Sergeant First Class Maya Cross. Special Forces Combat Medic. 6 years attached to ODA 574. 3 combat tours. Bronze Star with Valor. She's probably forgotten more about trauma medicine than you've learned." Stephanie Chen's mouth actually fell open. Maya's hands clenched at her sides. "Colonel, I'm just a nurse now. Let the doctors." "The patient is crashing," one of the Secret Service agents interrupted, his voice urgent. Maya's training overrode everything else. She was moving before thinking, crossing to the stretcher where the general, she could see the resemblance to Whitmore now, was showing signs of cardiac arrest. "V-fib," she announced, reading the monitor. "Someone get a crash cart." "I'll handle this," Dr. Brennan said, pushing forward. Maya's hand shot out, stopping him with a grip that surprised them both. "With respect, Doctor, you hesitate. I've seen it 100 times. This patient doesn't have time for hesitation." "How dare you?" "She's right." The voice came from the hallway patient, the ranger. He'd wheeled himself to the doorway, his eyes bright with recognition. "That's Reaper. I heard about her in the 75th. She pulled 8 men out of a collapsed building in Mosul while taking fire. If she says she can save him, she can save him." The crash cart arrived. Maya was already moving, her hands remembering the rhythm she performed under mortar fire, in sandstorms, in the belly of a Chinook while taking evasive maneuvers. "Charging to 200, she called out. "Clear." The general's body arced. "Nothing." "Charging to 300. "Clear." Still nothing. Maya's mind raced through the possibilities, not just cardiac arrest, but what would cause a general to collapse during a classified briefing. Stress? Pre-existing condition? Or something else? "Wait." She leaned over the patient, her trained eye catching what others had missed. "His pupils are pinpoint, and there's perspiration that doesn't match cardiac presentation." She looked at Whitmore. What was he doing before he collapsed? "Drinking coffee." "What?" Maya's stomach dropped. "Who made the coffee?" "I don't. It was already in the conference room when we arrived." Whitmore's expression sharpened. "What are you thinking?" "I'm thinking organophosphate poisoning presenting as cardiac arrest." Maya looked at Dr. Brennan. "I need atropine. Now." "That's insane," Brennan said. "You can't just get her the atropine." Whitmore's voice was a command. One of the Secret Service agents was already on his phone, speaking urgently. "If I'm wrong, we've lost maybe 30 seconds, Maya said, her hands already preparing in forepush. "If I'm right and we wait, he's dead in 2 minutes." Dr. Walsh handed her the atropine, his movements uncertain. Maya administered it, then stepped back, counting seconds in her head the way she'd counted them in combat. 15 seconds. 30. 45. The general gasped, his body convulsing, then steadying. The monitor showed a rhythm, thready, but there. Second dose of atropine, Maya ordered, her voice calm. And someone get toxicology down here. We need to confirm organophosphate and identify the specific compound. She worked for another 3 minutes, her movements precise and confident. The general stabilized. Color returned to his face. Behind her, she could feel every eye in the ER watching. When she finally stepped back, peeling off her gloves, the silence was absolute. Sergeant Cross saved my brother's life. Whitmore's voice carried the weight of command. Anyone want to question her competence again? Dr. Brennan looked like he'd swallowed glass. Stephanie Chun was pale, her earlier smugness completely gone. How did you know? Dr. Martinez asked quietly. Maya turned to face the assembled staff. Because I've seen nerve agent exposure in Syria. I've treated chemical weapon victims in Iraq. You see enough of it. You recognize the signs. She met Brennan's eyes. That's what 3 combat tours teaches you. Pattern recognition when lives are on the line. The Ranger patient was grinning from his wheelchair. That's the Reaper I heard about. Whitmore stepped closer, his voice low enough only Maya could hear. Why are you here, Sergeant? You were being fast-tracked for officer candidate school. You had a future in special operations. I had a past in special operations, Maya corrected softly. I needed to do something else, sir. Save lives without the killing. You're wasting yourself. Am I? She glanced at the general, now breathing steadily, alive because she'd been there. Respectfully, sir, I disagree. Before Whitmore could respond, FBI agents poured into the ER. The attempted assassination of a 3-star general had triggered a full federal response. Maya gave her statement, explained her reasoning, and provided detailed observations that had the agents taking rapid notes. Through it all, Dr. Brennan stood silent, his earlier arrogance completely deflated. When the FBI finished, Maya retreated to the break room. She was shaking now, delayed adrenaline response, normal after high-stress situations. She'd saved a general's life, but all she wanted was to disappear back into anonymity. The door opened. Whitmore stood there, and behind him, Dr. Brennan and the hospital's chief of medicine. Sergeant Cross, the chief began. It's just Maya now, she interrupted quietly. Whitmore shook his head. No, it's not. Maya met the colonel's eyes, exhaustion settling into her bones. Sir, with respect, I left that life behind. Did you? Whitmore gestured to the ER beyond a break room. Because from where I'm standing, you just executed a combat-level tactical medical assessment that saved a 3-star general from a sophisticated assassination attempt. That's not just Maya. That's Reaper. The chief of medicine stepped forward, his expression grave. Miss Cross, I owe you an apology. We all do. Dr. Brennan has explained how you've been treated on this staff. Dr. Brennan looked like he wanted to melt into the floor. I had no idea of your qualifications. Your resume listed nursing school, not. Because I didn't want it to matter. Maya's voice was quiet but firm. I wanted to be judged on my work as a nurse, not my military service. Well, the work speaks for itself now, the chief said. I'd like to offer you a position in our trauma department. Proper title, proper recognition, and a significant salary increase. Maya shook her head slowly. I appreciate that, but think about it, Whitmore interrupted. But first, I need to ask you something, Sergeant. The FBI is investigating the poisoning. They'll want your expertise. You identified an organophosphate compound that their initial field test missed. You're the only medical professional in this hospital who's seen this kind of exposure in real-world conditions. Then I'll help them. That doesn't mean my brother is awake. Whitmore's expression softened slightly. He's asking for the medic who saved him. Will you at least come see him? Maya hesitated, then nodded. They walked through the ER together. Whitmore in his civilian clothes that couldn't hide his military bearing. Maya in her baggy scrubs that no longer hid her competence. Every staff member they passed stared openly. The Ranger patient caught her eye and saluted from his wheelchair. Maya found herself returning the gesture automatically. General Whitmore was in a private room, monitored closely by Secret Service and medical staff. When Maya entered, he tried to sit up straighter. At ease, General, Maya said softly. You need to rest. You're the medic. His voice was rough but steady. My brother says you diagnosed organophosphate poisoning in under 2 minutes. 90 seconds, actually, sir. And it was pattern recognition, not genius. Pattern recognition that saved my life. He studied her face. You served under my brother in Afghanistan. Yes, sir. 3 years. He says you're wasted here. That you should come back, work with Saka Medical Development, train the next generation of combat medics. The general paused. What do you say to that? Maya looked at the monitors, the 4 lines, the careful medical choreography, keeping this man alive. I say I'm exactly where I need to be, sir. Even after how they've treated you. Especially after. Maya met his eyes. In the military, I had respect. I had rank. I had authority. But here, I have to earn it every single day. I have to prove myself with every patient, every decision, every moment. And when I save a life here, it's not because someone ordered me to. It's because I chose to. Whitmore Sr. and Jr. exchanged a look. That's the most Hoa thing I've ever heard. The general said finally, a slight smile crossing his face. The FBI investigation took 3 days. Maya provided detailed analysis that helped identify the specific compound, a modified nerve agent traced back to a domestic extremist cell. Her testimony was classified. Her role in preventing a general's assassination was quietly noted in files that would never be public. On her next shift, Maya arrived to find the staff break room rearranged. Someone had posted a small plaque. In honor of Maya Cross, RN, SFC, Red, who reminds us that the quiet ones are often the strongest. Dr. Brennan was waiting by the nurse's station. Cross, Maya, I wanted to apologize. Properly. What I said, how I treated you, it was unprofessional and wrong. Accept it. Maya's voice was genuine. But I need you to understand something, doctor. I don't need you to know my background to treat me with respect. Every nurse here deserves that, regardless of whether they have a Bronze Star. You're right. I'm working on it. Stephanie Chen approached hesitantly. Maya, I'm sorry too. I was threatened by you, honestly. You were always so calm, so competent, and I took it out on you instead of learning from you. Then learn from this, Maya said. Every person in this yard has a story. Every patient, every nurse, every orderly. We don't know what battles they've fought. Treat everyone like they might be saving your life someday. The shift was different. People asked her opinion. Residents listened when she spoke. Dr. Martinez specifically requested her assistance in a complicated trauma case, and afterward thanked her by name. Near the end of her shift, the Ranger patient was being discharged. Maya wheeled him to the exit personally. You know, he said, I looked you up. We tried to. Most of your service record is classified. The important parts usually are. Why stay here? After they treated you like that? Maya smiled, the first genuine smile she'd managed in weeks. Because this is my mission now. In the military, I save soldiers. Here, I save everyone. Teachers, kids, addicts, homeless veterans, 3-star generals. Everyone gets my best, regardless of rank or circumstance. That's worth more to me than any medal. He saluted her again. You're making a difference, Reaper. Don't forget that. After he left, Maya stood in the ambulance bay, watching the sunrise paint the sky in shades of gold and pink. Her phone buzzed, another text from her old team leader. This time, she replied, Can't make the reunion. Working. But I'm good. Really good. When she walked back into the yard, Dr. Walsh called out, Maya, incoming trauma, motorcycle accident. You want to take lead? Copy, she said, then caught herself. Yes, doctor. But this time, there was no correction needed. Because they knew now. The quiet nurse in the baggy scrubs was also Sergeant First Class Maya Cross, who'd earned her call sign by pulling soldiers back from death itself. She was Reaper. She was Maya. She was both. And she was exactly where she belonged. In the chaos of the ER, surrounded by the beeping monitors and fluorescent lights and human suffering that never stopped, Maya Cross had found her new battlefield. This time, the enemy was death itself. And she was winning, one patient at a time. The invisible ones usually are.